The health department obviously has focused on public health issues for a numerous amount of years. In 2014, there was a partnership that was formed between us, our local hospital, the school system, local government, and many, many more. And in 2014, they basically formed what we now call as BC 360. This force is wonderful because it's a partnership that we're able to all come together and focus at the table of the various needs that Beaufort County has. One of them was the behavioral health, emotional well-being, and substance misuse in Beaufort County, which then led to the creation of what we refer to as Behavioral Health Task Force in 2015. The Behavioral Health Task Force is one of BC 360's longest acting task force, and with that momentum over the years has gained to where we are now, which Ms. Tiffany is our coordinator who oversees the Behavioral Health Task Force, and she came onto our team in 2021. This task force has been the ones that's really had the minds, the means, the partnership. They've come up with funding opportunities and other outreach that have led to such things as the podcast or as the community action events and so much more.
Some of the initiatives that we have is the community education campaign that we're running. We want to make sure we get out in the community, inform people about the dangers associated with substance misuse, substance abuse, the support that individuals with mental health disorders need, and just the services and resources that are available to them in the county. One of the big tasks that we took on when I took this position initially was we understand that there's a barrier to care in Beaufort County due to the geographical divide. So one thing we wanted to do was address the transportation issue. So for individuals, say for instance on the south side of the county, who cannot get into Washington, which is the hub, where most resources are located, we actually started a community event. Basically, it's community engagement and outreach, and we call it Community in Action. We go around to each town in Beaufort County and we take all of our programs. We have mental health providers there. We have individuals who can do primary care there. We have a program through Beaufort County Health Department called Prevention Point. We want to make sure that we are addressing the spread of communicable diseases associated with substance use disorders. So we take Prevention Point with us. They take life-saving medications with them. Our providers that are available at the events, they actually have an array of resources that they bring to the community. We actually invite anyone who's in need to come out, even individuals who suffer with food insecurity. We have food on site for those individuals. So that, of course, brings a lot of people out because there is an intersection between mental health, substance use disorder, and food insecurity and other social determinants of health. So we actually try to get anyone who is in need to come out and join us at our events. Mental health disorders, substance use disorders, all of this is all wrapped up into one blanket. All of it is connected, so there are a lot of stereotypes about what this looks like, who can be affected. It's a fault of a certain individual. It's, something that a shortcoming that they have, and that is not true. That is one of the biggest myths that we want to debunk. Anybody can fall victim to mental health or substance use disorder. So we want to make sure that people are not failing to come and get the resources they need because of the stigma associated with it. We do have a podcast series that we run called Riverfront Talk, Substance Matters. We want to go out and highlight the actual individuals who have dealt with these disorders, who are currently dealing with them, and some who are in recovery. So we just ask that you help to spread the word about the good work we're doing in Beaufort County and just come out and help and support.
Well, I think as public health, what we do best is we quote unquote roll with the punches. The needs of this community are ever changing. We do community health needs assessments and various other assessments to really hear from the community about what's going on and what their needs are, and then doing our best to adapt to that. Currently right now, substance misuse and behavioral health as well as mental health is still at the very forefront of needs. We hear that from our local partners as well as community members. And so right now that is still one of our main focus areas in which we're trying to reach people. I would say that never be afraid to call us at the health department. One of the best things that we do is, yes, we provide services, but we are also really good at connecting people outside of what we're able to provide for resources in our community or surrounding communities that can help people, whether that's from their health, their mental health, nutrition, but we are good connecting resources. So make sure you're outreaching to us at the community and action events, however you can. Don't be afraid to ask of what you need, and hopefully we can put you in the right direction.